So the most important thing ever is that you matter. Every single human life matters. And when you're at your darkest and your lowest, and you just feel like you can't do it anymore, that's when we have to have that conversation with ourselves and say, I've got to take some of this energy that I'm burning into fighting this, and I have to turn it inwards to myself.
What if the most powerful pain intervention isn't a procedure or a pill, but 3 words that change everything? We believe you. Welcome back to the Modern Pain Podcast. This episode continues our series where we put the lived experience of people in pain front and center. Today we're joined by Keith Meldrum, who survived a devastating car crash at 16 and then spent decades navigating surgeries, nerve blocks, and a system that often dismissed him. Keith shares what it was like to live in constant pain while fighting both his body and the healthcare system, and how a single moment of validation shifted his entire path. We'll explore why pain is always biological but rarely only biomedical, how stress and stigma can crank up the volume, and how moving from fighting to willingness opens the door to function and meaning again. If you work with complex pain or you live with it, this episode offers real-world strategies, powerful reframes, and a story that proves recovery isn't just about eliminating pain, but reclaiming life. Now, on to the episode.
This is the Modern Pain Podcast with Mark Kargela.
Keith, I know your story a bit, but I'm wondering if you could kind of share a bit of what it was like when pain was at its worst, where you felt like you were in that struggle with pain.
Maybe I'll just frame it with a little bit of context as how I got there. Everybody's story is different. Mine is just mine, but I think it helps to just paint a little picture of, what happens to get me in that. Because I believe the precipitating event also was some of the causes of my challenges over a few years. So I'll make it short. And many years ago now, it's almost 40 years ago now. Good thing I was sitting down and I said that. But in August of 86, when I was young and didn't make good decisions, at 16 years old, I got behind the wheel of a car after drinking most of the night and got very little sleep, and found out in the hardest way possible that a combination of alcohol and lack of sleep will cause you to fall asleep behind the wheel. And then when you're trying to drive down a rural highway in the middle of British Columbia in Canada, when the highway bends on a big curve, you don't, and you go straight over the bank and roll your car down end over end, and you have this rather, in my mind, spectacular car accident. I don't really remember much of it, and I was inside at the time. But that accident, while I was wearing a lap belt, it caused just significant internal trauma. It tore me apart inside just quite horrifically. And if the car accident wouldn't have been witnessed, and it just barely was, 2 people saw me leave the highway, we couldn't see the car down at the bottom of the bank. So that's where my life would have ended that cool August morning. But fate intervened, and 2 ladies saw this crazy guy driving down the wrong way right for them when I pitched her off the highway. So that's what sort of entered me into a life of pain. And it was sudden. But what I also want to acknowledge is that genesis is different for every person. It can be something as simple as waking up one morning and you have pain in your back that wasn't there when you went to bed. Or you can have a traumatic car accident like I had. So the how really isn't relevant, except for in my case and for others, it does paint a bit of the background color to a story. So that's what happened. Wound up in a hospital. I was in the hospital in the ICU for 10 days and had major surgery. And I wound up having multiple surgeries after that because there was just so much damage and trauma. And I was launched right into almost immediately a life full of pain. And I remember once I was at a teaching event, a pain school in Quebec. And somebody had asked me, when did they think my transition from acute to chronic pain occurred? And as we know, the golden rule is 3 months. And we can have a conversation about that some other time. But I said, I think it happened while I was lying in the ICU. And the reason for that was I had no path other than where I went, because the surgeons told my parents after my accident, the words that my mother relayed to me was, she said, the surgeon said, he's going to live, but he's going to have a whole bunch of problems later. And it was just ended at that. There wasn't like, and when that occurs, here are the things that we can do to help him. It was like, he's alive and it's going to cause problems later, and full stop. And it did. And the years after my accident were just fraught with pain. Right from the time that I left the hospital, it was always there and it never went away. And I'm 16 years old. And as we know, as males, the male brain doesn't fully develop till I think the day we die. And then maybe it's not still quite. But so at 16, in my head, I'm thinking, well, I'm young and I was fairly strong, thank God, back then, because I think that helped get through what I did. But I'm like, when I was a kid playing sports and I would break bones all the time, broke nose playing hockey and collarbones. But you broke something and it hurt and then the hurt went away and the thing that got broken got better. So in my mind, I'm like, I got hurt, then I got broke, and they fixed the broken thing, and I got to get better. And I never did get better. And that caused me to be on this focused path of they've just got to fix me. It's great that they patched me up when I had my car accident, but they missed something. There's more that they can do. I didn't have the right surgeries. And I was focused on making the pain go away because I thought they just didn't get it all or didn't do what they needed to do. And underlying all of that, and this is why I wanted to just share what caused the accident, was in hindsight, and this is probably about 10 years ago that I really came to realize maybe some of the challenges were also brought about by being 16, being in a near fatal car accident, lying on the ground. And one of the few memories I have from that accident was begging to die. I had no will to live anymore. And the pain to this day is I don't have any words to describe it. It was just all encompassing. And I didn't want to live anymore. So I have all of this, like I gave up and I wasn't strong and I wanted to die. Terrible car accident, all of this stuff. And at no time did somebody say, this could be a bit of a problem for you. You might want to talk to somebody about that. Never, ever offered an opportunity to talk through it. Having said that, if I probably would have been too stubborn to say, I'll take it, because I just thought I needed to push my way through it and find somebody who could fix the pain. All of that to say, 15 years, I chased down every intervention. I made decisions in my life to prove to myself and to what I thought was the world that this car accident and my injuries weren't going to hold me back, that I was going to be anything I wanted to do. And I kept making life decisions and trying things in my life that just made my pain worse and would cause me to wind up going into the hospital again. And those interactions, and this is the late 80s, early to mid 90s, we're challenged now with the stigma and the misunderstanding and the dismissiveness and the sideways glances of chronic pain or persistent pain, especially when you enter you go back 30 years. It was terrible. It was just like you were immediately suspected of being a faker, all sorts of other issues. I remember laying on beds for hours before anybody did anything because they would just kind of leave you there to sweat it out because I think they didn't believe you half the time. Life was just full of these terrible choices I made, trying to push through, believing in my mind that the pain had to go away because I couldn't believe that you could live with pain. Like anytime I'd hurt myself as a kid, the pain went away. And why wasn't it going away now? And I tried every intervention, and if they could stick a needle in me, I had the needle done. I had multiple surgeries. They would go in sometimes and they don't do this as much anymore, not nearly as much. Back then, they'd be like, oh, maybe we missed something. They cut me open again and go rooting around in there for I don't know what. And I would suggest all that did was actually cause more harm than any good. But there were times when some doctors thought they were doing the right thing. But it was just a life consumed with pain and a lot of confusion and misunderstanding in my life as to what caused it. And on top of all of that was an interaction I had when I was 19 with my family doctor. I'd had probably my third or fourth surgery by that point. And I'm in his office and I'm saying, it still hurts. Like I still have this pain. My left side and my flank, it still hurts all the time. And I remember like very clear to this day, he just looked at me and he said, the surgeons have fixed everything that was broken. This is all in your head. So now I'm 19 or 20 or whatever at this point, and I'm dealing with all of this trauma, physical trauma from the car accident, this underlying emotional, probably psychological trauma that I pushed to the back of my head because I didn't want to have to deal with it. And then I'm told I'm making pain up. And that just screwed me right up because I kept thinking to myself, how crazy must I be to keep doing this to myself, pretending I have pain, putting myself through all this terrible interactions and needles and surgeries if it's not real. And it just created this knotted, balled mess of emotion and pain and just not really knowing what to do and not finding anybody who could help me. I just kept getting dismissed, or I would be told on numerous occasions, what do you want me to do?
I'm wondering if you could discuss a little bit of your relationship with pain as you were in the midst of that struggle. I know it's changed over time, but I'm wondering when you're in that struggle, like how did you view pain and what was your relationship with it as you were going through that difficult stretch?
It was nothing short of adversarial. I viewed my pain as the enemy, and As I mentioned earlier, I viewed it as, and again, it kept in the back of my mind was my GP back then saying this is all in your head. So I'm like, then I just have to push harder. It hurt. I knew it hurt. I could feel it, but I'm like, maybe I'm making it up. Maybe I'm making it worse than it is. Maybe I'm attention seeking. Maybe I'm doing all these things. So I just had this truly adversarial relationship with my pain. And every day was a dance of it trying to knock me down and me trying to push it down. And that's what constantly led to these decisions and pushing myself to do things because I just thought if I pushed harder, I could get past it. I could get on top of it because I obviously just wasn't trying hard enough. Or in my head, I just needed to think my way out of this pain and just bear down and push through it. But it was always there. It was always in my mind. And those who are listening, who live with pain, it's with you 24/7. You never get a break from it. And it was always right up front. I now refer to it back then as it was the shadow that used to walk ahead of me and trip me up all the time. It was always there. And sometimes we could get along. And a lot of the times it would just stick its foot out and trip me up and down I would go. And we would just tumble and hit our way through another mess.
You mentioned the fix-it approach that you were after and that a lot of people are after, right? We want it fixed.
Mhm.
And I think healthcare maybe puts that message out there not with negative intentions. I think in the grand scheme, I think most healthcare people are looking to do their best for somebody. But
Yes.
I'm wondering if you could speak to that for people who are like struggling with why isn't healthcare fixing me? And where maybe you see the shortcomings of that kind of thought process from healthcare.
That is probably, for me, turned out to be one of the biggest moments that took me a long time to get to because, like you, I think I dealt with a number of healthcare providers who did want to try and help. And so they would try these different interventions because they were physicians and they saw somebody who had a problem. They wanted to do their best to fix it, but it just never worked. And I was focused on fix it because, as I said earlier, I remember I had a pretty good bike accident. I broke my collarbone and cracked my elbow as a 12-year-old. And I was fine. I got up, walked my bike home, and I was fine until I came to the front door of the house and my mom went, "Oh my God, what happened?" And then that's when I cried. But until then, I was fine. It just tells you a little bit of the emotion and psychology of pain in there. But that collarbone and everything, it healed and it got better. And I was focused in on this. I can't believe I'm not willing to accept that you can live with pain every day. Like I'd never met it. I didn't know anybody who had. I probably interacted with them, but I didn't know it. So in my little brain that was still developing, I was like, it's not possible to live with pain every day. They've just not done enough and they need to fix it. And I kept pushing and I realized I was probably a bit of a challenging patient at times because I was always looking for somebody to fix me. And I was like, you just got to do something. And I'm sure sometimes that was a bit much to handle because I was just so focused on you have to fix this. I cannot believe that this can't be fixed because it's not humanly possible for somebody to live with pain 24 hours a day for the rest of your life. That is just not humanly possible. But sometimes what goes wrong in our body, whether in my case it was this car accident or whatever is the sort of genesis of that pain, it just sometimes there is not the magic bullet as much as we want it to be. And I did for nearly 20 years. I was seeking that magic bullet, that panacea. And it took me a long time to realize that everything I was doing, the pushing and the fighting, I joined the Canadian military when I was 21 because I was going to show the world how tough I was. And I wound up having surgery in the military because in one physical training class, I just had a terrible pain breakthrough and my gut didn't blow apart, but they went in and operated on me. I kept making terrible decisions to prove that I could make the pain go away. And it took me a long time to finally realize everything that I was doing that I thought was the right thing to do, to push and to find somebody to fix it, wasn't working. And maybe I was wrong, but there was it took another interaction for that to really land for me.
The view on pain, because I think we're all taught, like your experience was, is I have pain, something's wrong. I go to healthcare takes care of it. My pain goes away. Yes. And that obviously got shaken for you because it was a pursuit of trying to find somebody to take it away and it wasn't there. I'm wondering if you could reflect on how you view what pain is and how it's maybe a little bit more than that simple equation of damaged tissue, fixed tissue, pain go away type things. I'm wondering how your view on pain has changed over time and through this experience.
that is, I think, one of sort of the most important things in my life that I've gone through. We all have these very important moments in our life, and not to minimize any of them, but getting married was a pretty big moment for me. It was really important. But starting to understand what sort of the totality of pain is and what it means was really very pretty defining for me, because I was going down a path of fighting, gotta fix it, in and out of hospitals. It was really disruptive to my life. It's causing lots of problems. And I don't think I'm wrong to say that if I didn't find a different path, and if I didn't find a different relationship with my pain, the path that I was on, I don't think it would have turned out very well. I don't exactly know what would have happened, but I don't think it was going to be where my life went otherwise. It was just not a good path, and it was not a good relationship. There were times early in my marriage when I would say to my wife, I just wish I hadn't lived through the car accident. I just didn't want to do it anymore. It's just so frustrating. I never had thoughts of suicidality, but there were a couple of times I remember saying, I just wish I hadn't lived because this is too hard. And what was really important for me was when I started to learn that pain, you can have tissue damage, but that's not just what pain is. And often, especially for chronic pain, it actually never is just the tissue damage. All pain is biological, but not all pain is solely biomedical. And what I mean by that, and I didn't understand this at the time, and I did actually want to fight against it, was that pain is influenced by our lives, everything around it, the world that we enact within and that acts upon us. And when this was first introduced to me, I just thought it was a bunch of hippie garbage, people trying to find a way to just dismiss me without saying, I can't help you, so this is on your own. But it's true that pain is truly emotional, spiritual, psychological. Your day-to-day life, everything impacts your pain. So in my case, I still have, my pain is neuropathic. That's a damage to that nervous system. But that's not just it. It is the emotions and the psychology and the stressors that I'm under and all of those things. And once I started to see that and find ways to change my relationship with some of those stressors, so moving away from the pushing and the fighting, because let's face it, we live in an environment in North America where we talk about battling your disease and fighting through something. So that was it. I had to put on my armor. I had to fight and battle. I wasn't going to retreat, because retreating is giving up. By retreating, and I don't mean giving up, but I mean by stepping back and not pushing against it, but allowing it to come in a little more, taking a look at it and say, what's going on today? Oh, I'm having a really stressful day. And if I can find ways to deal with that stress, guess what? My pain went down a little bit. And when I started to see those connections, which at first when I was told those emotions and psychology affect, I thought was just bunk. When I started to actually try it and see that it did have an effect, that's when I realized pain is so much more than just the damage that I had from my car accident. It's the life that I live and the life that is lived upon me that affects my pain.
People will comment on stories like I've shared with people who've gone through some pretty difficult pain things, and you're speaking to this right now, but they say, well, what about real tissue damage? What about real tissue damage? Like, I'm wondering where you think because that's a struggle to switch that thought process. I'm just wondering if you can speak to somebody who's having this difficulty, where maybe this is Keith before he's ready to make this. I got damage. This isn't my, I got damage. I know you're talking about all this psychosocial stuff and people get rightfully mad. I'm wondering what you would say to somebody who's having a real difficult time to consider that it's more than their tissues.
That is, I think, probably the single hardest thing to get over, because that was a nut that I just struggled to. And 25 years later, after adjusting my life, it still pokes me in the eye, because I have tissue damage. I was literally torn in half. I don't have most of my left abdominal muscles. I have a great big chunk of plastic that's in my left abdominal wall to hold me in there. Every time I had pain in my brain, every twinge, every torque, every twist in my brain was, I'm tearing something apart. I'm damaging it. And it was just a matter of, and it just doesn't happen overnight, at least it didn't for me, that I had to come to the realization that all of this trauma, all of this tissue damage that I had and still have, it wasn't getting more damaged. So when I felt that pain and I would tense up and I would stop and I would just get all stressed out, what I was doing was just adding to that pain through that stress. But I thought I was doing the right thing by stopping and guarding and like holding tight. Because in my mind, I was like, oh, I've ripped something. In my mind, it was always, I ripped something, something's ripped. And it's hard because it hurts. You can feel it. In my case, I can look down and see the multitude of scars that had been opened up numerous times and go, they cut me open and they went in there and I'm missing stuff and they put things in me. I had a colostomy. They took it out. Like my brain was so focused on all the biomedical issues. I was sure that all of my pain had to be related to that tissue damage and only that. And I think it's normal. When it hurts, you're like, see, the thing that got damaged is what hurts. And it might, but all of the things in our lives amplify that hurt. And when I started to take a step back and give myself some space and stop fighting it and stop being on top of it and stop just focusing on it as much as I did, I found that I could get that pain to modulate down and back off a little bit. I'd love for it to go away, Mark. I'd give anything to just have it gone. But the life that I have now with pain that is less, and that I understand more that all the damage that I had is not getting further damaged. I'm not harming myself. It hurts, but I'm not harming myself. And if I control the things that I can to help on those days when it starts to get pretty torqued to help back that off, then that is something that I need to do to help manage that pain. But it's really tough when you have physical damage to your body to not believe that is the sole cause of your pain. And really all that I can offer is it's not. It's affected by so many other things. And I'm not saying ignore it, because if I move the wrong way, if I try and lift my arms over my head or hold them up over my head, that brings on a lot of pain. Just so I don't do that. That's actually biomedical. So I don't do that because it really hurts. So I've learned how to move and how to care for my body in a way so that I don't exacerbate that pain. But I also understand when I do something and I move and it hurts, I no longer go right to something's tearing apart in me. I'm just like, oh, that I tweaked it. And I just got to take a breath, sit down, catch my breath, relax. And then the pain just backs down to its normal levels. And then away I go.
You've had a pretty difficult journey as you were navigating healthcare. And I remember you, and we've talked about this in the past, how it became your relationship almost with healthcare became very adversarial because of the frustrations you were having of difficulties to find anybody who was truly able to take this thing away for you. But then you had an encounter, and we spoke to this again, but I think it's just powerful to share for folks that maybe haven't heard this. I'd love if you could share a little bit of that turning point for you that kind of set you on a different path.
It's a point that I realized after it happened, just how important it was. And then as I got into my advocacy work and talked to many other people, I realized others had these same sort of pivotal moments in their lives. So for me, I was in a little bit of the backstory again, where I was chasing down interventions. I was having nerve blocks. I was having paravertebral nerve blocks. And one of the possible risks with those is you could possibly cause a lung collapse, because I always thought the needle was about this long. Sure felt like it going in, but it's an uncomfortable procedure, but I kept doing it because I thought it might help, and it never really did. But on one of the intervention sessions with a doctor who was really trying his best, he really wanted to do what he could. I had a partial left lung collapse, but a 1/3 collapse. And so he was like, okay, that's it. Like it's happened. They're not really effective anyway. And he referred me to a specialized clinic in Vancouver here in British Columbia and said, you might want to try or consider something called neuromodulation, which when I looked into it and it was connecting things to my spinal cord, I was like, I just don't know about any of this. But I was at a point, I just didn't know what to do. And I was still looking for the fix. And nothing else was working. So I talked to my wife because I really wasn't too excited about somebody rooting around in my spinal cord. And I said to her, like, I think I just have to try it. If this might be the last shot, and I think I just got to try it. So I went ahead with the referral and I went to the hospital in Vancouver, and I was sitting in a little dingy hospital room, as every story goes, because they're always little and dingy. And the doctor was doing the intake. And by this point in my life, so this is 2004, the accident's in 86, I probably related my medical history dozens of times to healthcare providers. And you get to a point where you're detached from your health and your medical history. They ask a question, you just answer it. And I wasn't even looking at him. He was sitting off to one side, and I'm just kind of staring ahead, and he's asking questions, and I'm just answering them by rote. And we're going through it, I don't know, maybe halfway through, I'm not sure. And he had just stopped asking questions. And I looked over and what the hell? And he put his pen down. And in my mind, I'm like, oh, yeah, here we go. I didn't even make it through the intake. I'm such a loser. Like they figured out right at this point, so this isn't the right thing. It's not that bad. They can't help me. In that moment, I had just every thought go through my head as to why this was just going to be an abject failure. And I was just, probably within seconds, I had just gone flat. But I looked at him. I was just waiting for the rejection. And his name is David Hunt, Dr. David Hunt. And he just looked at me and he held my look and he just said, "It's okay. We believe you." And I was expecting, "You have to leave because we can't help you." And that was the first time in nearly 20 years I actually had somebody in healthcare truly, with compassion and empathy, look me in the eye and say, "We believe you." What he said was, "Your pain is real." Like, he didn't say those words, but by saying, "We believe you," he said, "Your pain is real." And I was like, in my head, I was like, hallelujah, somebody finally believes me. And I'd love to say 24 hours later, I had a complete new relationship with my pain. Not so much, but that was the beginning. The change in my path from going down the one that was not a healthy relationship with it at all, and fighting and not having the best quality of life by any stretch, that allowed me to change that trajectory. Just even 1 degree, a 1 degree course correction over time, that's a big change. And it took time, but he gave me that 1 degree change that day. And over time, it moved me onto the path where I find myself today, which is having a better relationship with my pain and learning how to live the best life I can despite.
Speaking of relationships, I'm wondering if you could speak to a bit about how relationships were impacted by pain. I know it sounds like your wife was very supportive throughout this as you've journeyed through it, but maybe not even just relationships with your spouse, but I'm wondering, like, just even relationships with coworkers. I'm wondering how you felt pain really impacted relationships that you had.
That is, it's something I've certainly learned and heard a lot from people over the years. That is one of the most challenging things, because I would suggest, and thankfully I didn't really experience this, and I think that's just through the grace of whomever you believe in. I had just an amazing support network and didn't realize it, but pain can be an absolute relationship killer. And it can be if you have a partner, it can be that relationship. It can kill your relationship with your family, your friends, because over time, people just start to want to disassociate with people because it's like you're always in pain. You don't want to do things. You're irritable. Man, I was an irritable guy. I was not fun to be around sometimes. And who wants to be around a guy who's just grumpy and snapping at people? I was fortunate that my wife, who I am prepared to nominate for sainthood, never gave up. She always stuck by me. And I had a group of friends who always supported me as well. And I think there were times when some space was given. They knew when it was time to just give me some space. But I was fortunate that I didn't suffer some of those like crushing relationship, sort of destructive moments, which can be just really soul crushing. And one of the things that just adds to people's pain, because your social network is gone, and that causes stress. And that stress then feeds back into your pain. So for all the things that weren't going right for me throughout my entire pain journey, my parents supported me. And when I got married, my wife supported me, and the employers that I had supported me. So one thing I cannot complain about, I was so fortunate, but I could see how easily it is to have those relationships erode, because pain just sucks the life and the soul out of people. And that just drives a wedge between them and the people close to them. You don't want it to, but it just does.
Often hearing those stories of some of those relationship challenges too, that can obviously supportive situations that can really help pull you through. And then some other ones where it's a struggle to maintain some of those good relationships when you're dealing with a mighty struggle at that on your own. I want to move it over towards acceptance, because that word has some connotations and some difficult interpretations from folks that hear that for the first time. And that's often proposed as something that we want to help people work with. I know there's better words, and maybe there's ones that you have that you prefer. But I'm wondering if you could speak to maybe acceptance and how people might view it incorrectly, and maybe you did as you were first hearing it, and what you thought maybe came to mind initially. And then as you've understood it and how it's applied to your own situation, I'm wondering if you could share that.
I would say the word acceptance is probably one of the great big red hot buttons for a lot of people. Again, through my process, my sort of path and journey with pain was this really convoluted, twisted thing. And I actually never had anybody say to me, you just need to accept this. Because when I was going through pain, at that time, there were no pain clinics like we see today. So I never had those kind of interactions. Nobody handed me a tattered pamphlet that said, here's self-management. You need to accept your pain. I was just always told, you just need to learn to live with it. Learn to live with it, which means to accept it. And that is, if you look at somebody who's in their darkest moment in pain, and the best advice that the healthcare provider or somebody can give to them is to look them in the eye and say, hey, you just need to accept this. They're lucky if they don't get punched in the throat, because it's not really the message that somebody wants to hear. But what they mean, and in some of the work that I do in being able to present to healthcare providers, is to learn how to couch that presentation of that word, and there are different ways. And Bronnie Lennox Thompson, our dear friend, she gave me the word years ago, willingness. So instead of acceptance, willingness. And willingness in that, what am I willing to do to help myself live better with my pain? And that's a little less sharp than you need to accept it. Because acceptance feels like somebody's telling you, it's all you, you're on your own, we're abandoning you, we're going to be over here, and you're just going on your way. But regardless, there needs to be people, I had to, and others, you have to come to that point. You have to have that moment where you look yourself in the mirror. And I actually remember a day having a conversation in my head where I talked about, I need to just figure out what to do differently, because what I'm doing isn't working. It's making it worse. And maybe I don't know what I'm doing. And so that was my own internal acceptance speech, which was, maybe this, and at that time, I still wasn't prepared to say it's going to be with me for the rest of my life. But I was like, maybe this is going to be around for a lot longer than I want it to be. So what can I do to help myself just live a little bit better with this? Because everything I've done for the last 18 years is making it worse. And I just didn't want to do it anymore, Mark. It was just too hard and it was too tiring. And I often believe, and I've had a few conversations with people, actually, sometimes people actually have to be almost at that bottom point where they're like, nothing else is working. So I need to be willing to look outward a little bit and then inward at myself and say, what can I do to just help myself just live like a little bit better tomorrow? If it's just a little bit better tomorrow, then I can worry about the day after that, because you're not going to change it overnight. It takes a long time to retool your life from the fighting and all the things that you've been doing. You don't just 24 hours later go, oh, I got this, I got it all figured out. Hell no. But if you do a little bit today and then a little bit next week and some more next month, and again, it's that trajectory change, that 1 degree course change over time, you will find it is a big change. But it's a moment, and I did. I remember I was sitting on the couch in my living room in my head, and I was having a conversation about, I can't do this anymore. It's not working. I need to find ways to learn to live with my pain somehow, because it's obviously going to be with me for a while. Acceptance is a tough word. I like willingness. I like conversations about talking to people about what is it that's important to you, even if there's one thing. Because ultimately what we want to do, if we want to regain function, we've lost a lot of the things in our lives that are important to us. We've lost function. The things that we like to do, we can't do them anymore. They like to walk and now they can't walk anymore. Then what can they do? What are they willing to do to maybe start walking just a little bit? And, oh, look, I walked 100 meters today. I used to walk 5 kilometers. I can't do that, but I walked 100 meters. Oh, look at that. And then over time, that 100 becomes 200 and 1,000. But it's about regaining function, about regaining control, right? Getting that locus of control back and just regaining our life a little bit. So acceptance can be a little bit harsh. It can come across a little knife edgy, but it's about that willingness to change. And that has to come from within. Nobody could make me do that. That had to come from me. And again, as I've said probably too many times, it was because I just couldn't do it anymore.
You had mentioned the adversarial fight and battle in healthcare and the cultural narrative is pain's weakness, leaving the body. We got to fight. I'm wondering if you can tie that to willingness. Do you think there was a willingness to drop that fight and not in a surrendering fashion, right? I'm wondering if you could discuss where willingness in that struggle and how that relationship with pain maybe changed as you showed that willingness to maybe not have to fight this passenger that we're not really fans of, that are part of our journey anymore, but maybe something that you could tolerate or had a willingness to have that still be present. But man, I'm willing to do some things in life that are meaningful and matter to me. I'm just wondering if you could share that in your experience.
That was hard because at least I was I was wired that way. And I still think it's a little bit prevalent in healthcare. So we still talk about it. It's like I have another unrelated disease and talk about fighting that disease. I'm like, it's not really helpful words because I have a certain amount of energy capital and I don't need to be burning it up on things I don't need to be fighting. But what I had to learn was I was in my mind, the fight showed my strength. If I fought against this, I would rise up. Literally in my mind, I was rising up every day and I was battling against it because that's what you do. You're strong and you fight against it. And I had to learn that the greater strength was coming from stepping back. Sometimes an army has to retreat in order to win. And our greatest strength can come from taking that step back and saying, I can't fight this anymore. I need to find a way to live with it. Like we got to find peace. You got to, if it's a battle, we're finding a truce because the battle's never going to end and it's just going to wear everybody down. And in the end, you're just going to be a shell of yourself. So the greatest strength, and it was really hard for me to accept and to understand, was my greatest strength came from not fighting anymore, which is really counterintuitive because you're wired in your brain to fight because that's what you do. And I go back to having my car accident, 16 years old, lying at the bottom of the bank, pawing at the dirt. I remember that as clear as day, begging, pleading to die. And afterwards, after I got out of the hospital and months later, I was so ashamed because in my mind, I had given up. I was weak and I wasn't strong enough. And I didn't try to fight through it in that moment, that defining moment of my life. I just felt so much less than a human being because I just gave up. But the greatest strength comes from recognizing that you can't always fight. And life will be better when we just take that step back. And as you said, look at the things that we can do to regain some function in the meaning in our life. And that's when you can start moving forward again. And at that point, you're going to move around what you're fighting with. Like, because butting up against it isn't working. So you just got to find a way to flank it and get around it. And that's you got to move back, re-strategize, and then find your way around.
Some great advice. I'm wondering if you're somebody here listening to this is in some of the dark times, some of the difficult times where you mentioned as part of your journey, you hit that bottom, but I'm wondering what you'd want to somebody here who's going through that right now.
So the most important thing ever is that you matter. Every single human life matters. And when you're at your darkest and your lowest, and you just feel like you can't do it anymore, that's when we have to have that conversation with ourselves and saying, I've got to take some of this energy that I'm burning into fighting this and I have to turn it inwards to myself because it also requires some self-compassion. I personally never wanted to have any self-compassion. I was mad at myself. I had felt this was all my fault. And I had this terrible fight with the healthcare system. I had a terrible fight with myself. But we need to have some self-compassion and say, I am worth being here and worth living. And if I'm burning up all my energy by fighting these external forces and I'm just not going to win, I'm going to channel some of that energy back on myself. And it actually takes energy. This might sound weird, but it takes energy and strength to not fight, to rechannel that into yourself and to love yourself and to care for yourself and to give yourself space to say, I am worth it and I can do this and I just need to find a different path. It's the one that you're on. I have yet to find anybody, and maybe they're out there, I've yet to find anybody who has gone down the path of just hitting it head on and beating their head against it, that it's worked. If they're out there, I haven't met them.
That makes two of us. Keith, we could talk forever because I always enjoy your perspective. And as we're huge fans of making sure stories like yours are told so people can see what some people who may look like the situation they may be going through or some of the deep, dark struggles that folks in pain go through. So I wanted to thank you personally, but also those listening, I'm sure want to thank you for all the work you're doing to tell your story, but also to advocate for healthcare professionals to listen and to have more people tell people, I believe you, which is a shame that still isn't front and center for most of our healthcare encounters. So again, thank you so much for what you're doing. And we're going to hopefully get you here and talking to us soon and look forward to projects in the future. Well,
I appreciate that, Mark. And I'll just leave this. There's a quote that I use all too often. And this goes for healthcare providers a little more, but it goes to there's not enough compassion and humanity in healthcare. I'm not saying none, but it's just, there's not enough. And William Osler, who was a Canadian physician, 1849 to 1919, one of his, I just love this quote: "The good physician treats the disease. The great physician treats the person who has the disease." We need to treat people first as human beings, and that compassion and that humanity will give them the runway they need to be able to move forward.
Great quote. We're going to leave it there this week. For those of you listening, we'd love if you could subscribe to the podcast. If you know somebody who's struggling with pain, share this episode to them so they can hopefully get some words of wisdom from Keith and maybe a new direction to take with their pain. I'd love if you could share the episode. We will leave it there this week. We will talk to you all next week.